Yes, come in.
Hello,
Hello.
Mr. Johnson?
Yes, you can call me Bob.
Okay, nice to meet you, Bob. My name is Sarah Scott. I'm a second year medical student.
Nice to meet you, Sarah.
Is it alright if I do your history and exam today?
Sure.
Alright. So what brings you in?
I have a knee pain.
Which knee is it?
It's on the left knee.
Can you describe what it feels like?
It's a pain in my left knee that started about 24 hours ago, and it's pretty bad.
Does it feel stiff? Is it a sharp pain?
It's kind of stiff pain.
Have you noticed any tenderness at all?
Yeah, it's warm and tender there.
Does it stay in the joint or does it kind of radiate to other parts of your leg?
No, it stays in the joint.
If you had to rate the pain on a scale of 1 to 10, 10 being excruciating, what would you rate it at?
Probably 6.
Okay. You said this started about a day ago.
Yeah.
Has it
about that.
been pretty constant?
It doesn't change with time. It's pretty constant.
Okay. Have you tried anything to make the pain go away?
I tried ibuprofen and it didn't help much, and I applied ice and hot and heat, and it didn't help too.
Okay. Is there anything that makes it worse?
I tried to rest, and the rest didn't help.
Does it hurt more when you're walking and moving around?
Yeah, I can barely walk.
Okay. Have you noticed any other symptoms that you're worried about?
Not much.
Okay. Have you had any recent injury to that joint? Did you hurt yourself that you can
No,
remember?
I didn't have any injuries.
Okay. All right. I'd like to get a little bit more information about your medical history. Do you have any drug allergies?
No, I have no allergies.
Okay. Do you have any chronic conditions that we should make note of?
I have high blood pressure.
How long have you had that?
It's about 7 years.
All right. Do you control it with medication?
Yeah, they put me on a water pill, HCTZ, 50 milligrams once a day, so I
Okay.
take it regularly.
Do you take any other medications?
Occasionally I take ibuprofen if needed.
Okay. As far as you're aware, have you ever had any other joint problems? Your hands, hips, feet?
The other day I had a great toe pain on the left foot, and I've taken ibuprofen, so it helped.
And when was this?
It was several years ago.
Okay. You said you took ibuprofen. You didn't have to see the doctor about it at all?
No, I didn't see anybody.
Okay. Have you ever been hospitalized or had any surgeries?
Yeah, I had appendectomy when I was 28 years old.
Okay. Can you tell me a little bit about your family history? Do they have any conditions?
You mean my parents?
Yes.
My mother is 85 years old. She has rheumatoid arthritis and she has dementia, and she is currently in the nursing home. And my father died when he was 79 from the heart attack.
Okay.
And my grandparents, they were pretty healthy. As far as I know, they died from the old age.
Okay. Can you tell me a little bit about yourself? What do you do for a living?
I'm a manager in a bank. I'm working there for 30 years.
Oh, wow. Are you married?
Yes, I'm married.
Any kids?
Yeah, we have 3 kids, and they have all college graduates.
Awesome. What do you and your wife like to do for fun? Do you have any hobbies?
Yeah, we like walking, and now this walking hobby is compromised with my knee. Usually we walk around 2 miles every day.
Okay, so you haven't been able to do that lately.
At least last day. Yeah.
Yeah. All right. Can you tell me a little bit about your diet and exercise routine?
For exercise, we are walking on the daily basis, and diet is pretty simple. Mostly we eat a lot of meat, and we like cheese,
Okay.
especially hard cheese from Netherlands.
Okay. Do you use tobacco products, smoke cigarettes,
No,
any other drugs?
no.
Do you drink alcohol?
Usually I drink a glass of red wine at meals once a day.
Okay. Just have a few more questions and then we can get to the physical exam. Have you had any recent weight loss, weakness, muscle weakness, fatigue?
No, I'm trying to lose weight for the last 15 years and I'm still overweight.
Okay. You have that history of hypertension, high blood pressure.
Mhm.
Do you have any other heart problems that you're aware of?
Not to my knowledge.
Okay. Have you ever had any burning with urination, increased frequency of going to the bathroom?
Actually, I had some kidney stones. Yeah, I had those symptoms when I had kidney stones, but I was able to pass the kidney stones without surgery.
Okay. And then as far as your joints go, you have this pain in your left knee, and you said you've had pain in your toe before a few years
Yes.
ago. Okay. All right. We can go ahead and start the physical exam if you'd like to get up on the table.
Okay.
All right. First, I'd like to start off by listening to your lungs. Is it all right if
Thank
I
you.
pull your gun down just a little
Sure.
bit? You can just breathe normally. I have you take some deep breaths in and out. Alright. Your lungs sound clear. Next I'm going to listen to your heart.
Thank you.
Alright. Pull this back up. Have you noticed any rashes or lesions that you're worried about on your skin?
Not really.
Okay. Next, I'll take a look at the knees. Alright. So you said this one is
Yeah.
feeling
It
a little tender. I can tell it looks a little red and
Yeah.
swollen. Feels a little warm.
Yeah.
Just gonna compare the two. Just gonna palpate a little bit.
Oh.
Try and push lightly.
Uh.
Any touching hurts?
Yeah.
Any down here?
Mm-hmm.
Okay. Alright. I'm gonna check the strength of your legs. I'll have you push out against my hands with your legs and then pull back. Alright. I'd like to check your range of motion, so I'll have you lay back
Okay.
on the table. Oh. We'll start with your good knee. I'll have you bend it
Okay.
all the way up to your stomach if you can, as far as you can go. Okay, good. And back down. And then it go as far as you can with this leg. Alright.
It hurts.
Okay, you can put it back down. Alright, you can go ahead and sit up. Alright, that's all I have for the physical exam, so you can go ahead and sit back in the chair and we'll talk about the exam findings.